All right. Hi, everybody, and welcome to the first session of the Virtual National Adaptation Forum Tribal and Indigenous Climate Adaptation Series. My name is Carrie Schaefer, and I am the project coordinator for EcoAdapt's National Adaptation Forum. I'm going to say a few words here in the beginning, and then I will pass it off to our session moderator, Cynthia, for the rest of the time. The first thing that I want to note is that we are having a few technical difficulties today. GoToWebinar is having an issue with their video system, so we will have no video, unfortunately, today, but you will still get all the same great content. I should also say that they just started a wood chipper right outside of my window, so I apologize if you're getting any of that background noise, but this is the world that we are in today. So when we start, the first thing I wanted to do is thank the sponsor for this event, the Walton Family Foundation. This entire series was made possible by their generous contribution, and we appreciate them for providing us with the space to discuss these important topics. For this session and for the rest of the series, we're going to be using GoToWebinar. So I wanted to take a moment to point out some of the main features. So hopefully your screen looks a little something like this. On the right hand of your screen, you'll see your microphone and speaker settings. You can adjust where your sound is coming from using the drop-down menus here. Using this button, you can enter into full screen mode. And then you'll also see that we have a spot for you to ask questions. Although if you would prefer to ask a question out loud, feel free to raise your hand and I can unmute your microphone so you can speak directly to our presenters. Okay, so the last thing that I wanted to touch on is how to get the most out of this session. So first, we ask that you remove distractions for the next hour and a half. I know after a year and a half of many of us living in a virtual world, we're kind of used to multitasking, hopping between our tabs, and kind of half watching as we scroll through our phones. So during this session, we'd like you to try to remove those distractions and give your attention to the speakers and really engage with the material. Next, we ask that you interact with our presenters and with one another. So we want this session to really be as interactive as possible, so feel free to send in questions or raise your hand during the Q&A session so our presenters can hear your thoughts. In addition, we know that the chat feature is not available in GoToWebinar, so we have created a discussion board in Padlet where our speakers have posed a series of questions that they hope to get your responses to. And so we will be dropping this link to the board into the chat once our discussion gets started. For those of you who may have not used Padlet previously, I'm going to take a minute to describe how it works. So here at the top, you can see the questions that have been posed for discussion. If you're interested in replying to one, you can click this little plus button underneath a post to add your comment. When you click that plus button, a box like this will pop up for you to enter in your thoughts. You'll want to type into this little lower section here, and then you'll click the publish button in the top right-hand corner of that box. So now you can see that my post has popped up. If you see someone else's post that you think is interesting, you can like it with this little heart button, or you can also comment on it right below. Or again, you can just add another new post to the thread. And so that's kind of a quick rundown of how we will be using the Padlet today. And again, I will be sharing that link once we get started with our presentations. So to wrap up our tips for success, I wanted to mention that this session is just the first in an entire series focused on tribal and indigenous climate adaptation. We would love for you to tune in to the rest of the series. You can register for these sessions at nationaladaptationforum.org. And so with that, I am going to turn it over to our session moderator, Cynthia.
All right, thanks, Carrie. I appreciate that. And thank you for going over the information as well as informing us in regards to the technical difficulty that GoToWebinar is having today. All right, well, good afternoon, everybody. My name is Cynthia Naha. I am a member of the Hopi tribe. I'm also Tewa and Ihang Tawan Dakota Oyate, and I am currently the New Mexico Tribal Liaison for the South Central Climate Adaptation Science Center, and I will be your facilitator for this session today. So today what we have and what we're presenting to you is a panel session brought to you by the Paula Band of Mission Indians Tribal Climate Health Project. And our speakers are going to be Shasta Gaughen, who's the Environmental Director and Tribal Historic Preservation Officer for Paula Band of Mission Indians, as well as Angie Hacker. She's the CEO and Principal Consultant of Prosper Sustainability, and she's helped and assisted Shasta with the Paula Band of Mission Indians Tribal Climate Health Project. I'm gonna go ahead and turn it over to you, Shasta and Angie.
Good morning. Hello. Can everybody hear me now? All right. I'm hoping for I can't do a thumbs up just because there's no way to see folks, but
yes,
yeah,
we can hear you, Shasta.
Thank you, Cynthia. Since we're having a few technical difficulties, we're just going to go with it and hope for the best. Sorry I can't see people's faces and you can't see ours today, but nonetheless, we are delighted to be here to talk with you about our experiences over the past 5 years on the Tribal Climate Health Project. And I'm also delighted to be here with my co-presenter and partner in crime on all this, Angie Hacker. And I'm going to turn it over to her to let her introduce herself.
All right. Hi, everybody. Good morning or good afternoon, I guess, depending where you are in the country. I want to start off by saying thank you to EcoAdapt and National Adaptation Forum for having us here today to kick things off. And welcome to everybody who's attended. We're just really fortunate to be here with you today to share some of what we've learned over the 5 years that we've been running a little program called the Tribal Climate Health Project. And so, let me get my slide to the next. All right, so the purpose of today is really to share our best practices, the lessons that we've learned, some tools and resources that we've developed through the federally funded Tribal Climate Health Project, which is led by the Paula Band of Mission Indians. And so we have about 75 minutes during our portion of the presentation today that will be together. We hope it's interactive and full of facts and things that folks can take back with them and insights, even if you're not a tribal community or a tribal serving professional. We know that there's a growing interest among professionals in learning how to work with tribes and learning how to support tribes as they face the disproportionate effects of climate change. And so our agenda for today, we'll do a little bit more introduction, and then we're going to give you an overview of the Tribal Climate Health Project. And then what we're going to spend most of our time on is what we've learned in the last 5 years, and there'll be a couple of segments. So the first one, we'll talk about our trainings and what we've learned by developing and providing trainings all over the country, and what we've also learned by designing data tools. And I'm really fortunate, Shasta's going to kind of tag team with me on this because she and I were co-facilitators. We've been working in lockstep on this project from day one. We're also fortunate to have Cindy Smallwood from Hummel Indian Village with us. She's participated in a lot of our programs and services, and she's just a fabulous person we get to work with down in the region in San Diego, where we do a lot of work. And then we'll follow up with some Q&A. And so if you do have questions, we're going to hold them to the end, but you can definitely add them to the chat as we go. And I know folks are going to be monitoring that. So before we even get in too far into introductions, I want to start off with the best practice, since that's what we're here to talk about today. So part of what we've learned after doing years of research and looking at best practices, looking at literature and curriculum, is that wellness as a function of mental health is often an overlooked area when we look at climate adaptation, even for folks looking at health. Looking deeper at the human, emotional, psychosocial impact sometimes doesn't get as much airtime. And so we've dove into that a bit into our research and our curriculum development. I just want to start here by sort of acknowledging that, when we talk about the health impacts of climate change, it's a heavy and scary topic, We know that it's going to affect our loved ones in almost every aspect of life as we know it, and it can be overwhelming. So part of what we like to do and what we've learned from the experts that we get to work with and learn from is to get ourselves really here, to prepare ourselves to take on these challenges. And so the evidence is saying that individuals and communities can get calm, centered, and connected. And if they do, they can build resilience and they can recover faster in the face of climate events. And so to get ourselves calm and centered in here, we're just going to take a moment to try to cope productively. And that just means trying to calm our hyper arousal. And we're just going to take 1 minute. Some of our experts call this a resilience pause or presencing. There's a lot of names for it. We're just going to take a minute to close our eyes and breathe deeply. If you have a special practice or healing practice you like to use, please do. But let's just take a moment, close our eyes, and breathe. All right, we can open our eyes back up. I feel a little calmer. I have a sick baby this morning, and sometimes you just need to take that pause. So I appreciate you indulging us and starting us off that way. Tribes are have particular practices to do this well, and we do like to incorporate this strategy into our teachings. So let's start from the top here. My name is Angie Hacker. I've been introduced. I'm a principal consultant, CEO of Prosper Sustainably. We work with tribes and other communities all over the country on all sustainability related topics, primarily climate change and energy. And I've been working with communities on these topics for about 20 years. Shasta.
Thanks, Angie. And sorry, I'm still sort of in my closed eye, deep breathing moment here, which feels wonderful. I am Shasta Gaughen. I am the environmental director and also the tribal historic preservation officer for the Paula Band of Mission Indians. We are located in Payom-Kawachum or Luiseno territory, and that's in the place that the colonizers named San Diego, California. I myself am not Indigenous, but I have worked for Paula for 17 years as an employee and for over 20 years in developing connections in the community. So it's been my honor and my privilege to be able to work for Paula all these years, and also to be able to work with other tribal and Indigenous and Native communities throughout the United States. And this focus on climate change that we've taken here at Paula is really my #1 priority because it intersects with every other part of the work that I do, both environmental and on the historic preservation piece of my job. So it's really wonderful to be able to talk with all of you today and tell you a little bit about our process with the Tribal Climate Health Project and how it began and what we're doing. So the Tribal Climate Health Project is a collaboration, and that's a really important piece. It's not just Paula, it's Paula with federal funding, partnering with Prosper Sustainably as our primary consultants, but also involving advisory groups from people from tribes, from tribal serving organizations, from colleges and universities, from other tribal serving environmental coalitions, all together to be able to develop this capacity building project that involves a website with a resource clearinghouse, a lot of trainings that we've done that we'll be talking about more throughout this presentation, and the development of data tools so that tribes can get the information they need to do the sustainability and vulnerability assessments and adaptation planning that they need to do. And we're fortunate to have gotten funding from a lot of different agencies, including the National Indian Health Board through the Centers for Disease Control, the Bureau of Indian Affairs, and the EPA. Angie.
Thanks, Shasta. So I want to walk you through, first we're going to start with our training. So like I said, we're going to have a couple of segments. This first segment is going to be what have we learned from conducting trainings. Then we'll move on to what we learned from conducting data or developing data tools. And so to kick this off, just what have we done with respect to training? You know, the hallmark of when we first started the Tribal Climate Health Park, our hallmark service that we were intending to produce was trainings. It turned into more than that, and we'll tell you why. But it's still central to what we do. So the general objective of the Tribal Climate Health Project from the beginning was to build knowledge and capacity for tribal serving professionals working to prepare U.S. tribes for the health and other impacts of climate change. So, you know, we did see a little bit of a void when it came to health impacts, or if there wasn't a void, it was maybe a lack of attention, not just with tribes, but communities across the country. You may hear a little bit about health in a vulnerability assessment or adaptation plan, but it wasn't, at least in 2016, it wasn't featured as strongly, as helpfully, you know, to the extent where it really was a focal point where you could address it through strategies. So that's part of what we're doing with the Tribal Climate Health Project, is raising and elevating the impacts of health as one of the top priorities of addressing climate change. So we've been compiling and synthesizing literature and best practices for curriculum development. We recruited subject matter experts to be advisors to help us develop and review curriculum. They've also supported us in various ways, including, you know, providing input and providing resources, they've been speakers. And when we've also built a variety of information sharing channels to get this information out. So we obviously have a website, tribalclimatehealth.org. We have listservs, we use social media. We have a really vast partner network of folks that are working on this. And I have to say, in this world, in tribal climate change and health, the collaboration has been very good, and a lot of folks are willing to help each other. So we really thank all of our partners and our subject matter experts. So far, we've conducted over 25 training presentations and 7 full trainings, which might be, you know, multiple sessions, along with other content like podcasts and publications. And these are all for generally a national audience on a variety of topics. So those might be, you know, they started off really being about the health impacts of climate change on tribes, so sort of a 101 on how do each of the exposures really affect tribal health, and then walking folks through the process of incorporating health in various ways into either vulnerability assessments and adaptation plans, or to other processes, other planning processes, where you can incorporate the projections and the impacts of climate change into things that are already institutionalized within your tribal government. From there, we really felt that there were some areas that required us to dive deeper and provide a little bit more information and content. So we've been diving more deeply into data. So we have a lot of curriculum around efficient fact finding and accessing data that you can use to build out your vulnerability assessments and really get a better picture for where the true vulnerabilities are and how to identify them and prioritize them. And then we got really interested in, like that slide that we had in the beginning where we did a little bit resilience pause. We got really interested in psychosocial resilience, or the mental health effects of climate change. And we have had various trainings associated with that, one called Coping with Crisis, one called Getting Ahead of Climate Trauma. And we have some really good partners that are helping us build out that level of knowledge for tribes. And then we also had a session on communities, climate action, and new U.S. leadership, where we brought in new staff of the new administration in the White House to talk about some of the impacts of new federal changes on tribes. That was, we just felt that that was an important piece to help tribes be looking out for changes that hopefully are going to support them as they move forward with their climate and health adaptation. And then most recently, we actually took a look at sort of the parallels between COVID and climate change and tried to find some very tangible examples of where we could translate COVID lessons into climate preparation in Indian country. So we developed a publication about that and ran a roundtable training on it recently. And we'll talk a little bit more about that. And then we try to provide ongoing knowledge building content for our, what we call alums. Anybody who's been through one of our trainings, they're all part of this sort of ecosystem or community of practice where we're continuing to provide content and support. So that's what we've done. Now, what have we learned? So I'm going to go walk you through a series of lessons, and I'm going to invite Shasta to kind of chime in where she wants to. One of the first things we learned is that obviously climate change has cascading effects, but we had to learn and figure out how we were going to organize them because we needed a home for the information. As we continue to find pieces of it, we needed it to go into sort of a cohesive framework. And so this is what this is a framework we use that is the foundation of our trainings. It's also the foundation of how we organize data tools, which we'll talk about next. And the point of it is to illustrate the cascading effects of climate change and how communities can protect assets against harmful impacts. And so it starts with climate change drivers, it goes to exposures. We focus on 5 primary exposures. That's how we organize ourselves: temperature extremes, wildfire, drought, storms and flooding, melting ice, and sea level rise. And what we say is that those are primary exposures, they lead to secondary exposures, including worsened air quality, vector changes, water insecurity, and food insecurity. And it's important for us to have distinguished the cascading effects, because everything we're learning in the literature and the research and from our peers and from other tribes is that those things are all having a variety of impacts, but they are unique, and it's important to understand how to organize certain impacts under which exposures. And so there are cascading impacts. Those are on categories like natural environment, built environment, health and social environment. And this is not terribly unique to tribes yet, except when we got to health and social environment, because we realized that the way that tribes wanted to look at health was not necessarily the same as how Western communities wanted to look at health. And we'll talk a little bit more about that. But for example, communities that, was that Shasta?
I was just going to chime in a little bit here. This is harder to do when we can't see each other's faces, but
Yeah,
just to say that these cascading effects might be things that seem pretty obvious, but there's also a lot of things that we've learned that aren't so obvious. And my favorite example is when I learned that something like wildfire and drought, for example, in Southern California, and actually throughout California, we have these events called public safety power shutoffs, where the utilities will shut off power lines in rural areas in order to prevent the possibility of a downed power line causing wildfire, and that's during high heat events and also high wind events. And so what happens is people don't have electricity, and so they might set up a generator. And setting up that generator, if they do it incorrectly, can potentially expose you to carbon monoxide poisoning. I wouldn't have thought of that as a potential cascading effect of climate change, but it is. So that's something that you have to include potentially in your vulnerability assessment, and your adaptation plan is education for people about how to safely use alternative power sources when some sort of climate event like high winds and wildfire causes power shutoffs to occur. So it's very much an integrated system of a lot of different things that potentially have impacts on human health and safety.
Right, and in talking with tribes that were part of our advisory committee, we got a lot of insights into, we'll talk about this. When we segregate the impacts between natural built environment, health and social environment, that doesn't really totally ring true, because health is interrelated amongst all of those pieces, and that is true. What Shasta is saying is absolutely true. Infrastructure becomes incredibly important, because without levels of infrastructure, electricity, transportation systems, there will eventually be an effect on health. When tribes told us how they look at health, they led us to subsections, including human health, which might look like physical health, medical health, mental health, but also cultural and spiritual health. and also socioeconomic health, which all wrap up into what tribes feel like is healthy livelihoods. So what else have we learned? We learned that climate changes well-being differently in different places, and so it became really important for us to acknowledge that tribes in various parts of the country were not experiencing the same climate changes. So Pacific Northwest and Great Lakes tribes were dealing with a lot around their fish, food, and forests. Alaska coastal tribes are dealing with thawing, erosion, impacts to their hunting practices. Navajo was dealing with heat and water insecurity. The Mojave had a shrinking river, which was affecting its spirituality practices. Tribes in the Southeast and Florida were dealing with hurricanes and sea level rise, and tribes more centrally located, like South Dakota, Lakota tribe, had bomb cyclones and flooding. So, but there were still patterns, and there were still ways that we could try to train folks across the country while acknowledging these differences. And part of what we did was to start building in regional cohorts and technical workshops into our trainings that were allowing for sharing on location-specific knowledge and peer sharing.
And that's really important, that we make sure that we are looking at things, first of all, holistically, just from the perspective of climate and climate change impacts overall, but also very specifically in terms of the individual communities and their needs. And I recently participated as a trainer in a session in Alaska, and I learned something there that I don't think applies as much to some of the Native communities in the lower 48. I also learned to call down here the lower 48. But in Alaska, they are dealing with the potential effects of climate refugees, because more people are starting to move north as they kind of see which way the wind is blowing, so to speak, as far as the effects of climate in some of the more southern states. So there are folks going up to Alaska and buying land, and they don't know how to live in Alaska, and they're causing disruptions to some traditional practices, perhaps inadvertently, but that's still something that the folks in Alaska need to deal with as part of their adaptation planning. And I wouldn't have known that if I hadn't gone to speak directly with the folks in Alaska in the indigenous villages who are feeling these effects.
Yeah, great point, Shasta. Huge impacts in Alaska, and they look different. Let's talk a little bit more about what we already mentioned, which was the tribes define health more broadly and holistically than just the absence of medical disease. And there's some examples of this. A good one is from the Swinomish Indigenous or Swinomish tribe, which developed Swinomish Indigenous health indicators, which look more holistically at what health means to the Swinomish tribe, which, they look culturally, look at education, they look at different various aspects of health, and that's how they're measuring their own health response to climate change. And it's very different. CDC, looks at health as feeling good, satisfied, positive life experience, but tribes might look at, you ask a hospital, they might be very clinical about it. Various tribal perspectives include, so here's one quote: nobody can be in good health if he does not have all the time fresh air, sunshine, and good water. That's from Chief Flying Hawk of the Lakota. And another quote from the Puyallup tribe.
Yallop.
I always get that one wrong, is our environment was rich in the wealth of natural resources, providing all of our needs, allowing us to live happy, healthy lives. On the right there is our framework, which, we basically took those primary exposures we talked about, that's the outer ring. Secondary exposures is the middle ring. And then we talk about generally the various kinds of health impacts. So physical health, the impacts to physical health could look like illness, injury, death, undernutrition, limited access to health services, whether that be electricity for medically, for medical equipment, or just electricity in general for air conditioning and all other sorts of purposes. It might look like access to transportation to be able to get to a hospital. Mental health is another category, so that might look like increased conflict and aggression, trauma, stress and anxiety, grief, and helplessness. Socioeconomic health impacts might look like cost of damages, loss of work days or school days, and then impacts to cultural and spiritual health might look like displacement, which would have enormous impacts, as well as disrupted cultural traditions. So those are just some examples of the kinds of health impacts that we start looking for. And one other way to talk about this actually comes from the US Climate Toolkit, which says Indigenous health is based on interconnected social and ecological systems that are being disrupted by a changing climate. Its impacts threaten sites, practices, and relationships with cultural, spiritual, or ceremonial importance that are foundational to Indigenous peoples' cultural heritage, identity, and physical and mental health, which I thought they just did a good job of wrapping that concept up. So in doing this work, and then we've trained over 1,000 tribal serving professionals to date, and we're having a lot of conversations in these trainings, and we're learning that tribal health is already at risk. And so we're obviously not just talking about a future problem. Communities that happen to be under-resourced or in remote locations or coastal are having health impacts already. And so the climate and health assessment that was conducted by the US Global Change Research Project has some key findings. Those are there on the left. It just says increased exposure to extreme events and coastal flooding will affect health. Disruptions to essential infrastructure can limit access to healthcare and emergency response services. None of these right here, this is nothing super specific to tribes, but it is just talking about the various ways that health will be affected by climate change. These come from different places. The climate health assessment is a really important document that we have always used as a foundational piece, but it ranges from medical and physical health, mental health, community health, and things like, I think that probably a lot of communities doing this work probably aren't thinking about things like vector-borne disease, water-related infections, food-related problems. And so that's just giving you a broad brush, but some of what we've heard from our participants is that a couple of quotes here. So from a participant in Central California, she says, in this area, wildfires have increased dramatically in intensity and size. The fires burn hotter and quicker. A participant from Southeast Oklahoma says, just in the last 100 years, the temperature has changed. My grandmother's never had air conditioning and we did fine. But now the elderly do not work like they used to. It's too hot for everyone. We really do not have long periods of freezing weather here anymore, which increases the bug population. So
yeah, so those are all really, and those are great quotes, to hear what people are experiencing as individuals. But of course, we know that this is community-based, and we also know, and it's become clear, and we'll talk about this a little bit more later, that the COVID-19 pandemic, even though it's not explicitly climate related, has helped highlight some of the disparities in access to healthcare that is experienced by Indigenous communities, and that's true for climate change as well. So we've learned some lessons from that we'll talk about a little bit later.
All right. So another lesson is, the good news that we like to share. Once we generally freak everybody out in our conversations about all the possible health impacts, we like to transition over to this concept, which is through adaptation, negative health effects can be prevented. And that actually comes from a quote from a vulnerability assessment that did a really good job actually incorporating health from Kiana, Alaska. And so this is the framework that we generally use to talk about the process of adaptation planning. So adaptation planning is what you would do in order to get your decision, the right priorities and decisions made about which vulnerabilities to address and how. And so this is sort of a real short summation of what a lot of processes look like. So there's no one right way to do this. We looked across all sorts of different organizations' models around how to do adaptation planning. And this is just what we felt was just the summation of a lot of good best practices, which first you do a vulnerability assessment, then you do an adaptation plan, and then there's an ongoing cycle of once you adopt it, you implement, you evaluate, and you update, and that's a continuous process. As you learn more, as you change your practices, as you evaluate how well things are going, and if you're seeing the benefits of adaptation. And so this is one way to do it. The other, there's a sea of ways to incorporate health and to protect health from the impacts of climate change. And we don't want to discount them. In fact, we want to elevate them. Things like ensuring that climate change is part of other institutionalized planning processes that the tribes might already be conducting. Those might look like community health assessments or community health plans. They might look like emergency management plans. They might look like hazard mitigation plans. There's a lot of different planning processes that would benefit from incorporating the realities and projections associated with climate change. Also, we learned in really diving deeply into what it means to understand vulnerability, we have sort of come up with this formula, which vulnerability really is a function of exposure risk, which exposures meaning those primary and secondary exposures that we looked at. How significant, how severe, and how likely are those that are coming to your specific location? So, you know, drought is a very big deal in the Southwest, less of a big deal perhaps in the Northeast. They have their own different issues, but looking at that, measuring it, and prioritizing the level of risk there is an incredibly important piece of vulnerability. So that's a function, that's one function. And then we look deeper. So not everybody says to do this, but we felt it was really important to look at, to not force tribes to make a wild assumption or a wild leap from, okay, precipitation levels are changing, and so what? Why do we care? Why does it matter? What's it going to do on the ground to the things that we care about? And so we look at impact risks, and that meant looking through everything we could find to try to assess out all the potential impacts of all that cascade down from all of the exposures we've talked about. Impacts being, you know, where a community comes into contact with an exposure that it's not in control of, that is going to affect its valued assets. That's the language we use when we say stuff that the tribes care about. And that could range from, you know, how will it affect your educational opportunities? How will it affect your economic opportunities? How will it affect your infrastructure? How will it affect your physical health? So you notice here, we're not necessarily staying in our lane in health only, but we're making sure health is incorporated as an essential piece of a comprehensive adaptation planning process. And along with that, you moderate this level of risk on the impacts with population sensitivity indicators and adaptive capacities. So population sensitivity would mean, you know, characteristics that make your community more sensitive to these risks. That might look like a high population of elders. That might look like, you know, a urban heat island effect. It might look like a high population of children that might be susceptible to certain impacts. And then you can moderate down the level of risk if the community has a certain level of capacity to adapt, or adaptive capacity. Adaptive capacity meaning there are strategies already in place or work that has already been done to increase the level of ability to adapt to the exposures and impacts that are coming. And that might look like, well, there's already a program in place to install more air conditioning, or there's already investments being made in flood control. And so as we're diving deeply into what it means to really understand a tribe's vulnerability, we run into what everybody runs into when they try to do vulnerability assessment, which is the volume of potential impacts is overwhelming. And it's overwhelming to any community, but if you're an under-resourced community where your one environmental, you know, tribal environmental department staff member is already doing 50 different things that are critical to protecting the environmental natural resources of the tribe, this is particularly overwhelming. There are tens of thousands of possible places to go look for potential impacts. And so this is just a smattering of the types of impacts that you go looking for, you go fact finding for, and try to understand which one applies to us and how badly does it apply. So things like air quality. So on the upper left, you're looking at it's predicted surface smoke from wildfires. That's one potential impact. So another impact might be to the upper right there, number of people within a FEMA designated flood area. That just means people that are going to be affected by floods. Or you might look at change in mortality rates. That's on the lower left, which, increasing, whether it's a low scenario or high scenario, or changes in Lyme disease case report distribution. So you can just see this pretty standard document, or pretty standard map showing the growing distribution of Lyme disease as the climate continues to change, as heat continues to change breeding patterns. And then on the lower left there, another impact is to projected percent change to national crop yields. So crop yields changes, which will change food, access to food. And then here's a quote from the APN Mapping Resilience Report that says, in Northwestern California, drought has decimated salmon stock, an important food, economic, and ceremonial resource for the Yurok, Hoopa Valley, and Karok tribes in the Klamath and Trinity rivers. So impacts were overwhelming. We found ourselves needing to organize them by exposure. And we'll talk about that a little bit more. That was really where we got to that point where we were awakened to the potential thousands of ways to look at impacts. We got really invested in the idea that we had to organize this information to make that easier for tribes to get their heads around.
And I keep wanting to chime in, and then realizing that I'll talk for forever about this stuff. But just like my example of having no idea about the potential for generators creating a risk, the same thing happens here. Is just it's like peeling an onion. You just get deeper and deeper, and there's so many layers. But the good thing is that we're figuring out ways to, like Angie said, organize this information in a way that's most helpful to tribes, especially those that don't have the resources to dedicate just, say, a single staff person to climate vulnerability assessments and planning.
Yeah, thanks, Shasta. As Shasta was saying earlier, we see some parallels with COVID, and this is one of our big lessons, and this won't be a surprise to anybody, but that tribes are disproportionately vulnerable and uniquely resilient. So you hear a lot about them being disproportionately vulnerable, and what we like to do is really highlight where they are uniquely resilient. And so I want to use COVID as some examples here. So we saw very clearly, in our research for our publication that, and despite being only 2% of the United States population, Indigenous people were 3.5 times more likely to contract COVID and 1.38 times more likely to die than white populations. So, we talked about historical oppression, broken treaty promises, centuries of neglect, persistent racial, health, social, and economic inequities being considered determinants for the outcomes that we were seeing, including the effects on mental health that are compounding historical trauma, and all the effects that were happening to the economic drivers that were essential to supporting tribal livelihoods that got particularly hit hard. And we looked at that and said, okay, well, we see this disproportionate vulnerability. We also looked for best practices. How are tribes serving themselves, protecting themselves? And we really noticed that tribes proved that they can be really proactive and without having to be at the mercy of federal or state agencies. And in fact, oftentimes with fewer bureaucratic constraints, tribes were uniquely flexible and could adapt more quickly than other governments to urgent and critical priorities, which we felt like was an obvious parallel to climate change, another mass health impact. And so, for example, the Northern Cheyenne tribe in Montana, they were successful with their testing. They tested 2,000 of 4,000 people through 2 large events by incentivizing people through gift cards, and they were able to quarantined those that tested positive and provided shelter for those who couldn't recover at home. The Wabanaki Public Health Department in Maine adapted a strategy from First Nation tribes in Canada called the Colored Paper Project to monitor the needs of elders sheltering in place. So the elders basically put paper in a window if they needed to indicate they had a need. At Chickasaw in Oklahoma, federal funds, they did a lot of things, but they used federal funds to construct facilities for use in future emergencies, including a new supply storage center. So supply storage became a big deal, and it will be a big deal to protect health in climate events as well. So swift action also by the governor at Chickasaw to declare a state of emergency helped to close all non-essential businesses and offices and led to safety, screening, testing, contact tracing, case investigation, epidemiological surveillance, and environmental controls. And so their data-driven approach has resulted in lower COVID infection rates for the Chickasaw workforce as compared to other communities in Oklahoma. So just some examples of some successes where tribes are demonstrating resilience, and they don't need to demonstrate it because they've been demonstrating it for thousands of years by continuing to exist amongst cultural and political change. So another lesson, the good news is that tribes are adapting despite their limited capacity and institutional barriers. Sadly, for some tribes, this looks like adaptation might look like relocation, which could threaten the loss of culture and sovereignty. And we see that at the Ile-de-Jean Charles Band of Biloxi Tillamoochet Choctaw Indians in the southeast. We see it in quite a few coastal Alaskan villages. Other communities like the Rincon tribe in San Diego is building a fire station microgrid with some help from state grant dollars, and that's supporting their health because, like Shasta mentioned, there's power shutoffs, power outages are pretty frequent in Southern California these days, which limits access to a lot of electrical dependent equipment. The Mescalero Apache tribe in New Mexico, they are constructing hoop houses and greenhouses to protect produce from climate extremes and solar systems at the fish hatchery. And other tribes, like the Homi tribe in the southeast, are responding to disasters through gatherings to build social connection. And we work with Dr. Douglas Walker at the Mercy Family Center, who has a program to help tribes do that. So just a smattering of a lot of different ways that tribes are already adapting. Our framework for this, where we sort of have organized strategies into types, is on the right there. Strategies we generally categorize as policy planning and land use, community engagement and notification, infrastructure improvements, data information technology, operations and management, and cross-agency collaboration. And just a note on the institutional barriers here. This comes again from the U.S. Climate Toolkit about tribes. It says barriers include limited access to traditional territory and limitations of existing policies, programs, and funding mechanisms that account for the unique conditions of Indigenous communities. So another lesson we've learned here is building tribal capacity to prepare for health impacts is going to take more than trainings. So that was a big lesson for us. It became overwhelming, even in a 10-session, 2-hour per session series that took several months. It was a lot of information, and I felt like we were leaving folks still overburdened, that we could provide a lot of information, but we needed to do more. And so what we've heard from our participants overwhelmingly is that they are always overwhelmed, even if they have access to funding. So staff capacity is stretched very thin because there's multiple priorities, especially when COVID hit. That just diminished capacity even further. Some folks were reprogrammed completely or reprogrammed to mission critical. And so what we hear a lot also is that community and stakeholder engagement in adaptation decision making is really difficult, and folks are always looking for ways to do that better. We talk about it a lot, but that it's super necessary, and we want to lift the burden of tribes off, lift the burden of having to do some of the other things so they can focus on this critical work of getting their community and their stakeholders involved in meaningful decisions. So tools and templates can help. That's our big learning, and part of what we're doing is developing those things. So one that's featured here is a survey template that we developed so that we could try to give folks some examples of ways that they can ask questions to their community. It's a free Google form. They can even just take it, copy it, adapt it for themselves, and use it for free to capture information if they have few resources to go out and do more robust community engagement.
And this is, the capacity thing is really a big deal. And, you know, here in Paula, I have a whole staff that helps me with capacity. But even with that, I still feel overwhelmed all the time. So I wonder what's it like for tribal communities that don't have the same level of staff. And one of the things we hear about all the time is that maybe we can increase capacity if we increase funding. But what do you do to get funding? You have to write a proposal generally. You have to do a grant. And in a lot of cases, it's even hard to get the capacity to write the grant proposal. So we really need to start from the very base level to be able to assist those tribes that need the help the most, and at least get them the capacity to even ask for the money and get it in the first place. So it's not as simple. I wish it was as simple as a webinar series, but it's just a lot more complicated.
Yeah, but you know, we're racking our brains to see where we can lift the burden, and we do know that we can help point tribes in the right direction of additional support and resources as well. So we have a resource clearinghouse on our website that features hundreds of different types of resources, from articles to reports to tribal adaptation plan examples, and it's filterable and sortable and mappable in a way that can really help navigate folks the information they need. And then we try to send folks to the right contacts that we know of. So we know that if you're in the beginning stages of an adaptation planning process, hopefully one that includes health, we would send you to your regional climate adaptation science center. We would send you to a USDA climate hub. We would point you in the direction of your tribal epidemiology centers. There's a regional tribal epidemiology center in every tribe's neck of the woods. There are federal and state tribal liaisons like FEMA and health departments. We would recommend connecting directly with state and local public health departments that have access to information and sometimes even technical assistance and support. Colleges and universities sometimes will have an Indigenous or tribal program, and tribally focused environmental organizations like ITEP have some additional opportunities for support. And finally, on this piece, we've learned that training format and feedback matter. So while we prefer to do in-person, online has worked well for us, especially with a national audience. We attempt to do this in a way that's more interactive than it is lecture, and we'll get to that in a minute. We like to have not just instructors, but you know, Shasta and I are often the instructors based on what we've learned, but we bring in guest speakers, and we also encourage our participants to provide their own short presentations on their own experiences during our trainings. We have also learned that a condensed timeline can be stressful, and so we try to sometimes stretch things out. We have heard that from our participants, that the longer engagement has been helpful so they can work through steps of the adaptation planning process in between meetings. And then we have done some mini series, meaning we don't have to do the full gamut of the entire curriculum. So we've done a mini series like on the getting ahead of climate trauma, where we have like a particular smaller topic. Session size, you know, 1.5 hours is pretty good. Going too long isn't good. And the national and regional participants, meaning we like to have a national audience, but where we need to dial in on regional information and peer exchange, we make time and space for that. And so on the right there is just some positive feedback we've received that's been instructive and continuously helps us to improve our trainings. So what's next? We are developing a health impact short video series. We have a vulnerability summit planned for 2022, hopefully in person, fingers crossed, on the, you know, with specific focus on health, recognizing and elevating tribal climate and health adaptation leaders. So we're developing a recognition program. Possible topics of future focus, we're going to continue diving deeper on mental, psychosocial, and health, obviously, mental health. Health impacts of drying water bodies. This is a new interest area for me. we know that tribes are experiencing water body loss, and want to dive a little bit deeper with some subject matter experts on the health impacts. And then climate change and infectious disease. And Shasta and I are also part of a different project here in California called the California Tribal Gaps Analysis, where we are asking tribes across the state about their experiences with climate adaptation and resilience, and we're going to be using the results of that study to inform our future trainings as well. So here's our panel discussion here that I want to invite Shasta back on for, and invite Cindy now to participate. Cindy, you're there, right? And maybe you can unmute yourself. Cindy, are you there? Okay, well, Shasta, let's start with you. I have a few questions for our panel. So now Shasta's kind of flipping roles from the administrator of this program to a tribe that is also using the benefits of what we're doing here in this program. So Shasta, do you want to just talk a little bit about what Paula is doing with climate and health adaptation and your role in that?
Sure, and it also looks like Cindy is with us now, so that's great, but I will start. So I mean, I would have to say that Paula is pretty far along in our climate and health adaptation, but it's because we are doing this project. So we used ourselves as the template, basically the guinea pig for working through this process so that we could then use it to help assist other tribes with their own vulnerability assessments and adaptation planning. So, my role, of course, is as the environmental director, but also as the principal investigator, essentially, for these different grant projects. So the thing is that I've been able to take what we've learned with training others to be able to continuously adapt our own planning. So that's been great. It's, they say that the best way to learn something is to have to teach it to others. So that's been my role. And now that Cindy is unmuted, I'm going to see let her answer the same question.
Hi, good morning, everybody. I just wanted to thank you for having me here today and introduce myself. I'm Cindy Smallwood, the Environmental Director for the Humul Indian Village of California. I'm in my office today, which is located on the beautiful lands of the Kumeyaay people who have been here since time immemorial. My role as Environmental Director is to develop a sustainable environmental program for the tribe. By seeking the funding and developing the documents for the programs that the tribe believes will best suit their needs for the present and into the future. So I actually bring those funding opportunities to the tribal council and to the general council, and then I let them decide what is best for them and go from there. But I'm always bringing new opportunities in the hopes that we can just keep growing the program. Sometimes it seems like there's just so many funding opportunities that sometimes they're not going to be applicable to the program that we're working on at the time, but sometimes there's just too many to apply for too. So, and like you said, the capacity building is kind of harrowing at times because I have a very small department and we can only do so much too.
Yeah, thank you. Thank you, Cindy. I'm going to go through the rest of these questions. I also want to encourage the audience for some participation here in the Padlet website. So maybe folks can put the link here again in the chat box for the Padlet, where you'll see it. These yellow questions are there, and we want to hear your thoughts on these questions as well. So this, the second question here is, how are physical, mental, and cultural well-being and traditional ways of life being disrupted by climate change at your tribe? And I would like to invite both Shasta and Cindy if you'd like to respond to that.
Sure. So I've thought a lot about this, and I'm going to focus on it from the Tribal Historic Preservation Officer part of my job, because what I have found over all these years of working in Paula and the lessons I've learned from people across the country is that there's no separation of the environmental from the cultural or the traditional or you know, the indigenous values. And so when you talk about the effects of climate change, people tend to think of them in terms of the environmental effects, you know, wildfire and drought, extreme heat, you know, melting ice and sea level rise for Alaska Indigenous folks and people in the Southeast. And so what we have to remember is that that's not just about the effects on the environment. And for tribes, when there is a disruption to something like a traditional food source, so here in California, it's been acorns from oak trees, then that can have an impact on people's spiritual and mental and cultural well-being, as well as their physical well-being, because of if you can't gather acorns because drought and heat have made the trees vulnerable and they're either not producing or they're vulnerable to pest infestations like gold-spotted oak borer, then that's a way of life that's being disrupted because you can't get the acorns, you can't go out to harvest, you can't make wee wish, which is that's the Cupeño word for the acorn mush. And that's not available for, you know, special events and milestones in people's lives, and that is a climate effect, and that's just one example. I have many more.
So I totally agree with Shasta on that, and on everything that she said. You can't have one without the other. Environmental and cultural go hand in hand. And I will give you the Kumeyaay word for acorn mush is shawi, so that we can have both words being used.
Mm-hmm.
And the disruption that I think of is the same. The food sovereignty and the traditional ecological knowledge that is being disrupted is devastating. So all of those things, but also with this question, one of the things that I was thinking about, it brought me back, and I know we didn't discuss it today, Angie, but it brought me back to the EASY tool. And when we were filling that out, I know a lot of the environmental directors and managers were filling that out for the tribes. I took it to my tribal council and chairwoman filled it out. And I thought that the things that I would have put into it would have been were different than what she put in. And so I thought it was really important that in situations like that, that those are the times when it is important that you take it to your tribe and let them put in that information for themselves, because they are the ones who should be giving that information. And you know, they're the one, it's their land, it's their culture, it's their environment. So it just brought me back to it when I was reading that question. So I just wanted to offer that information.
Yeah, thank you, Cindy. That's actually where we're headed next, is to talk about our data tools. So that's probably a good segue. I'm just going to focus on this last question here, which is there any one particular strategy that you could raise that's already working to help your tribe adapt to protect health?
Yeah, I'm going to use my favorite, and even though I haven't used it that much, I'm super happy that it's something that I have access to, and it's our text alert system. So we signed up with Alert Media, but Alert Media is not the only one. There are a lot of relatively low-cost text alert systems that you can sign up for, and I'm talking about the same sort of thing that, say, a company will use if you opt into their texts to say, hey, it's, you know, here's a 10% off coupon for the next 30 days or something like that. You can use that to alert your tribal members. Almost everybody has cell phones, everybody can text. So the way this works for us with Alert Media is that we have people opt in to this system, and when there is some sort of an emergency on the reservation or nearby, we're able to alert them using this system. And we most recently used it when there was a wildfire that broke out right on the edge of the reservation, close enough that it ended up burning onto the reservation. And I was able to actually look out my office window and see the flames, which was sort of alarming. But I was also able to immediately go to Alert Media and say, here's where the fire is. There's firefighters on the ground. There aren't any evacuation orders yet, but please stay indoors. And I gave them a web link to the local fire agencies so that they could keep up to date. And I heard from some of our tribal members later that the first notice they had that there was a fire on the reservation was from our internal alert system. And that made me feel really good, because fire is just going to keep on increasing, and to be able to do that was wonderful. We can also use it for poor air quality days. We've used it for extreme weather, when we're going to have extreme heat. So just to tell people where the cooling centers are. So it's been a terrific tool, and I love it.
Thank you, Shasta. And I know, so Shasta is way down deep the road of adaptation planning, because she's basically been going in lockstep with building Tribal Climate Health Project and doing adaptation within the Paula community. And Cindy has begun the process as well, participating in our trainings, using our tools, and now has recently received a grant to do some adaptation planning. You want to talk a little bit about anything that you're already doing, Cindy, that's already working to protect health?
Yes, so we are developing plans. We're doing several things. We're working on, we just completed our climate assessment, not plan, but the climate assessment through our GAP. We are moving now towards a climate adaptation plan, using a BIA funding, excuse me, the BIA resilience funding. And so we'll be working on that next. And that not only will include adaptation plan, but it will also include meetings and working with tribes to assist them in planning. So that's something additional with that funding that we'll be able to do. And then we're also doing surveys, and so that's helping too. One of the things that working with Angie and Shasta that I've been able to do, since they have so much already produced, is I can call up and say, gosh, I need a survey for this, and I've been trying to work on something, and Angie goes, oh, I already have that, and she'll send it over. So that's always really nice and really helpful, and I really appreciate that. We're not as far along, as Angie says, as Shasta is with her planning, but we're working on it. We're working on other things like emergency response. So things like having those numbers that you can call or set up, things like that, we're going to be hopefully getting to soon.
Thank you, Cindy. Yeah, and a transportation adaptation plan as well that we're all working on together, which has a focus on health as well. All right, I'm going to move us then. Thank you both. They're going to come back for more discussion in just a minute. I'm going to try to quickly go through the data tools piece, because this is the other big hallmark of what we're working on. So like I said, in the trainings, we learned a lot, and a lot of what we learned is that there's an overwhelming need for information, and we thought we could tackle that. So we have basically built a tool, what's called the Easy tool. I'll share it with you. And we have received BIA Tribal Resilience Grants, now the third award in a row, to help us basically test that tool with tribes, with groups of tribes, so far in California, to help us refine it and make sure that the information that is being provided in that tool is meaningful for tribes, that can help them make their way through the process of making good decisions about resilience and adaptation, to try to make it so that they can stop fact finding and spend their time on community engagement and get to action faster. And so that's really the goal of these projects. We're super fortunate to be continuously funded for that. Our latest project is going to take us basically from a focus on San Diego originally to a scaled up version in other parts of Southern California. And then this recent award is going to help us do work throughout California. And all of this is meant to be shared nationally.
And I just put a link to the tool that we're going to talk about real briefly, or that's going to be shared with you in the chat. But Also, Angie, I wanted to point out that we have only 18 minutes left, so we're probably going to have to get through these couple of slides so we can get to some audience Q&A.
For sure. Okay, so what have we learned? Data is key to adaptation. It's a huge part of the vulnerability assessment. Before you can move to adaptation, you need to first understand your tribe's unique and most critical and significant vulnerabilities, but it's overwhelming, like we said. We try to recommend to folks to use a braided approach to tell the best story that they can and to understand the severity and likelihood of threats and strengths. So data is powerful in that way, but data could come in the form of internal information like traditional knowledges, local observations, tribal reports, studies, and data, but it can also come from external information like credible reports and studies, and also publicly accessible databases. So what we have focused on is trying to aggregate as much of that information that's publicly accessible as possible and making it really easy to find. And so, like I said, there's thousands of data sources with varying levels of access and community readiness. And community readiness to us means not only is it raw data from some academic source that you have to try to interpret yourself, not only has it been at least somewhat calculated and analyzed so that you can make some meaning of it, but it's community ready, meaning that it's put in an accessible tool that's user-friendly, that it's got parameters that are location specific. It provides various temporal scales like historical projections and ideally visualizations that help with decision making, even decision making support. So there are tools that do that take it all the way down to that level so that the user can get to the point where they complete a report, that they can send it to their decision makers and they can move on and do the work of adaptation. Even better is if there's a customized report involved. But so we basically have scoured the earth looking for the best sources of information. And we came up with the easy tool. So it's the exposures, impacts, and strategies inventory tool. It's a companion to our trainings. It's trying to lift the fact-finding burden off tribes. It's filterable and customizable. It's just in Excel, so pretty much, most people can use it. And it basically organizes all of the types of information that go into making vulnerability decisions so that you can find them easily. So it suggests and organizes menus of these types of indicators. Community assets. So I'm just going to show you, this is a little snapshot of what it looks like. And what I want to really point out is that you don't have to start from ground zero to say, what should I even be looking for? What's an exposure? What does the research say that exposure is going to lead to secondary exposures? What are the best practices in terms of how to measure that with the right indicators? How do I measure that? What information am I even looking for? And then who can provide data? Hopefully that's visualized or mapped or in a way that's easy to use. And this operates like a worksheet that you can put your findings here, the historical baseline and projections that you find, and then you can actually put in a risk level, high, medium, and low. For example, for drought, based on everything you've been able to find, what does your community feel about the severity and likelihood of drought? There's a tab here too for impacts where we have mined through all the information about impacts. So what potential health and other impacts are associated with each of these exposures and secondary exposures? And it's a long list. So it's not necessarily the easiest thing to use, but it's taking the burden off starting from scratch and taking a lot of time off of trying to identify the right places to go get information. So we have a step-by-step guide that you can access, and I think Shasta's already provided the link to where you can find both the tool and the guide. There are still significant data gaps, and that's why we're continuing to work on this. So we know that sometimes data is missing completely. It's not location specific enough. It's missing timescales and projections. So even the best data that we find has lots of gaps. And sometimes it's just not easily attributable to climate change. So for things like PM 2.5, which is an air quality indicator, we don't know whether or not that's related to a wildfire or whether or not that's related to something else. So usually the data doesn't come episodically enough, like say to tie it to a wildfire occurrences. And so we're continuously trying to pluck off additional data gaps by looking for data sets and working with a huge list of partners that are helping us identify both what tribes need in terms of meaningful data and how we can try to fill the gaps. And part of the way we're doing that is by conducting something called the National Tribal Resilience Data Group. So this is a group of about 35 experts from across the country coming from private sector, nonprofit, academic, federal, state agencies, and tribal supporting organizations that are all working together to try to solve the problem around data access for tribes. And we are really actually making some good progress together, identifying where there are some gaps. Federal agencies like CDC just came up and presented this past month and are already trying to make changes based on the input that's being provided at these meetings. What's next? So we, like I said, we have these ongoing intertribal data development grant projects that we're working on, including a big California questionnaire that we'll be conducting next year to try to really hone in more on the data gaps that are still present and remaining for tribes and what would be most important. So we're refining our versions of the EASY tool. We are information sharing like today, but we're also doing very specific trainings on accessing data. And then we have our data work group. We're going to continue recruiting more folks for that, continue looking through all the best data sources we can find and seeing where there's ways to make it serve tribes better, or whether we can come up with a better solution altogether so that tribes can eliminate a lot of the time spent fact finding. So we're continuing to coordinate around state and federal agencies and lots more. So I think I will stop here and we'll focus on this yellow question, because if folks want to go back to Padlet, they can include their question, or they can include their responses to this yellow question, which is, where do you need access to better data to make decisions about which climate and health impacts are most severe and likely? And so while folks are doing that, I want to encourage Shasta and Cindy to both respond, if you'd like, to that particular question before we move to audience Q&A.
Sure. So there's no limit to the amount of data that we need to make better decisions, although I'll admit that I wasn't thinking from a data standpoint when I first started doing this work. But it is important to know exactly how climate is affecting people beyond just anecdotal information and personal stories, although obviously those are important too. We want to be able to drill down into specifics. And the more I do this work, the more I come across questions that I'd like to have answered with more data. And I'm not going to get too specific on that because I'll let Cindy answer, and then I'm delighted to get to some questions because I know we have some good ones.
Yes, and I'll keep this really short. I'm always looking for data, and sometimes it takes me down a rabbit hole where I don't need to be. It would be really nice to be able to get to the data that I need quickly. So data is always an issue, and it would just be nice to access data quickly and easily.
All right, thank you. So continue providing responses in Padlet. We're going to say thank you here and turn it back over to Cynthia, who's going to moderate, I think, some final questions.
All right, well, thanks everybody. That was really an interesting presentation and definitely a lot of information to take in and to absorb. I know for myself, I've done adaptation planning in my previous position and really trying to look at how to, I guess now in my new position, to segue into health and other similar fields, given that, as Shasta mentioned, climate change, when we look at it, it does impact everything within our communities, within our reservations. So from a holistic perspective, how do we begin planning at that level? So I do see there are quite a bit of questions in the Q&A, and I kind of want to get to those real quick. So I do have one question here. And Margaret Chavez, I hope you're able to get the computer to work. I do see your comment as well. So one of the first questions is, when you refer, oh, sorry, that was the wrong one. She got that answered. So let's see. Okay, so I know there was a comment that was shared that health is completely overlooked in Puerto Rico after Maria. And then there's another question that says, will it be possible to watch the recordings from today? A person had a conflict. And then another question is, has the TCHP ever broadened its lens to include fossil fuel burning and the health impacts of those activities on tribes?
We have, and this is Shasta, and I see that question is from Osamu, who we have worked with Cal OES, right? Osamu, Cal OES. I mean, our lens necessarily includes fossil fuel burning, because fossil fuel burning is what brought us to this place. So if we want to be a little bit more specific about that, then definitely that is part of air quality impacts, because we all know that things like ozone and particulate matter come from the burning of fossil fuels, whether it's vehicles or in other places. And I also learned through doing this work that ground level ozone becomes more concentrated on high heat days. So we're integrating the different ways that these different effects end up coming together and making health worse. So we definitely have, yeah, I mean, it's all about fossil fuel burning and what it's done to bring us to this place.
Thank you, Shasta. Any other panelists want to weigh in on that question? All right, well, if I'm not hearing anything else, I'm gonna move on to the next one from Maya Hayden. It says, how are tribes that no longer have land holdings engaging in climate adaptation? And she gives the example of tribes that are not federally recognized.
Wow. So this is Shasta again, but I think Angie will have something to say about this as well. So the project that Angie mentioned earlier about the California Tribal Gaps Analysis, we engaged with the non-federally recognized tribal communities in California that don't have land holdings. And I know that there are also some federally recognized tribes that don't have trust lands, but we are still reaching out to them, because climate change doesn't stop at political borders, whether it's a reservation border or a national border. So it affects all of us. So we are doing what we can to be able to make these tools available to those communities as well, so they can at least apply them within their own local areas, and then encourage them to work with their local health departments, their local governments who are doing their own climate adaptation planning. Angie, do you want to add anything to that?
Yeah, it's a challenge. I think about it a lot. Not just for tribes that no longer have land holdings, but also tribes that just don't have a significant on-reservation population. So where their populations happen to be in a very large, maybe land mass, how do you put a parameter and a boundary around where you're looking? Because a lot of the impacts are coming to a specific location. So I think it's a challenge. I'm excited to start working on Hamul's climate plan, because that was something that came up for us. They no longer have an on-reservation population. Cindy, do you want to talk about that at all, and just what you think that means for how you will, what you'll look at and how you will define your studies for climate adaptation?
Well, that's since we don't have a population right now living on the reservation, the tribe in the future plans on purchasing land, and the residents do plan on moving back. So in the future, that is the plan. But for now, there are issues that come up all the time and questions that come up all the time. So it is a challenge that we deal with. And that the tribe deals with. So it's just something that's ongoing that we handle in various ways.
Yeah, it'll be an interesting challenge for us to take on in terms of, how do we cast a boundary around the data when we start looking at vulnerabilities. And so I am interested in looking around at best practices for tribes that do not have land holdings, and seeing how they conduct their own analyses, how they draw their boundaries. And we look to places like the University of Washington, who has a tribal climate tool that is really good. It's only for the Pacific Northwest, but one of the things they did was go out and do a big questionnaire with their tribes to find out, how do those tribes identify their boundaries. And so they gave, in their tool, they actually have a drop down where you can identify a parameter or a boundary around a landmass, and it's not necessarily a reservation. And so it's how does the tribe identify their boundary, I think is a really interesting question, especially if you don't have land holdings.
Thank you for that, Angie and Shasta. There are just a few other questions. One is just asking if this information is on your website as well, and then to actually repost the link. So I know we're just about out of time here, but I do want to ask one more question to the panelists. And so if you reflect back 5 years, what do you know now about climate change and health adaptation that would have been the most surprising to you back in 2016?
Oh man. Well, I want to make sure that we've got our 2 minutes at the end. So I'm just going to say that I think almost everything I've learned has been a surprise. And 5 years ago, I wouldn't have expected myself to be addressing an audience at the National Adaptation Forum to tell them about what we've been doing. And I'm just amazed at having the ability to do that, the privilege to be able to do that. And I hope I continue to be surprised or not surprised by being able to help other communities, if that makes sense. Angie?
Yeah, I have just learned so much, and I guess I enjoy sitting from the place of really looking at tribal strengths, and there are so many of them that tribes are leading the way in a lot of ways ahead of Western, non-tribal communities. And I think there's a lot to be learned from them. Even though they are under-resourced, their ability to adapt and be resilient is something the rest of the country can learn from.
Awesome. Well, thank you, Angie and Shasta and Cindy, for your presentation and the information you shared today. I know I learned a lot. Looking forward to the rest of this series, and I'm going to go ahead and turn it back over to Carrie. Carrie?
Thank you so much. Okay, so I am just going to wrap up with a quick announcement about the National Adaptation Forum. So the in-person National Adaptation Forum will be back in the fall of 2022. Next month, we are going to be making an official announcement about the forum dates and location. So make sure to be on the lookout for our newsletter or check out our website. And then not long afterwards, in December of this year, we will be releasing our call for proposals. So if you're interested in presenting at the forum, keep an eye out for that. And then last but certainly not least, please register for the second session of this series, which will be held on November 10th. This session is going to be a roundtable discussion on community-led adaptation, featuring the panelists that are listed here, and you can learn more or register at our website, which is nationaladaptationforum.org. So with that, I want to thank everyone for coming out today, and I hope you have a great rest of your afternoon. Thank you.
Thank you, Carrie. Thank you, everyone.
Thank you, everyone. Have a good afternoon.